My name is Jamie Lazinski, and I am the Senior Director of Communications for Oswego Health. But more importantly, I am here today sharing this message as a mother of three and a resident of Oswego County. I'm here with Dr. Christina Lipke, the Medical Director for the Oswego County Department of Health, and we have an important message to share with you.
I'm here to inform you today that Oswego County has now joined other countless communities across our state, country, and world affected by community spread of COVID-19. It may sound corny or ridiculous, but I want to thank all of you because while this news brings us understandable worry, I am thankful that this news has come to us at the end of March and not the beginning. This news comes to us after our schools have been closed for 2 weeks. This news comes to us after so many of our businesses have closed and made that very hard sacrifice. It comes to us at a time when our churches have been empty. This means that we do have hope. While social distancing, this time of being physically apart from each other, has been difficult for all of us, it will not be for nothing. We knew that this day would come when Oswego County would be affected by community spread of COVID-19. And it is here, but I want to remind you that unlike hard-hit areas of New York City and Italy, we were fortunate enough to have our schools closed and our social distancing started before we saw community spread. Being apart and feeling alone, keeping our distance from each other is hard. I miss my church family. I miss my son who's in Florida in college. And I miss my son who's right here. Because like every other healthcare worker, I feel like I'm working all the time. And I know that you are missing people too. And I know that I'm not alone. There are people that you miss as well. This is our new normal. This new reality sucks, but it isn't forever. And it's not for nothing. Together, but apart, we will slow the spread of this virus.
And I too understand how many people are stressed beyond belief. This is a moment in all of our lives that no one would ever have imagined we'd be doing the things we are currently doing. I have 3 kids at home and I'm struggling to homeschool every day while trying to work remotely. And just yesterday, we had to celebrate my son's 4th birthday through FaceTime with his grandparents.
It's as simple as staying at home and limiting your trips to the store. If you do need to leave your house, please keep a minimum of 6 feet of distance between you and others you don't live with. That means if your children want to play outside with your friends, that's okay, but encourage games of frisbee or tennis, something that keeps that distance. You can still continue relationships with friends and family by video chatting or FaceTime, or even writing a letter, because there needs to be some physical distance between us. Doesn't mean that we need to be completely removed from each other. For years, I've counseled patients to limit their screen time when it comes to their well-being, and I've encouraged physical activity. But now I'm going to strongly encourage everyone that now is the time to connect with your family and friends. Even if it's with social media or Instagram or Facebook or Twitter, check in with your neighbor, check in with each other. That personal connection is critical right now.
We are all in this together. This may be the only time that each of us have a role and can impact what happens to our community in regards to future spreading of the virus. Physicians can't prevent this rapid spread. It comes down to each one of us. This is our community, our home, our families. Please do your part.